Thank you very much, Dr. Nitya. Thank you everyone for attending this session, and I'm so glad to be able to present some of our work that we do in the region. So my name is Midnight. I come from Thailand, and I work for the Asia Pacific Coalition on Male Sexual Health. And our main goal is to improve the male sexual health through increased investment, coverage, and quality of sexual health services for our communities. So by that we mean the MSM and the transgender populations in this region. And we work through coalitions of MSM and transgender populations here. So as you can see, we work with networks in China, India, South Asia, Greater Mekong region, Insular Southeast Asia, Developed Asia, the Pacific, and also Australasia. We also work with networks of young MSM and young transgender people, the Asia Pacific Transgender Network, and the Positive MSM Working Group of APN+. And I would like to present the work that we do that fed into the development of the WHO guidelines, which was recently launched. And it's called the Regional Report on MSM HIV Counseling and Testing in Asia and the Pacific. And the report is available up in the front if you would like to take a copy. I would like to acknowledge the 20 community-based organizations that we work with to produce this report, and also the peer reviews from WHO, from UNAIDS, USAID, and also from our funders from the Australian Federation of AIDS Organization and HEVOS, and the Mahidol University that helped to compile this information that I'll be presenting to you. So what's really exciting about the epidemics in our region is that it's concentrated, and there's an opportunity for us to talk on Asia-Pacific context, and to be able to do that here in Melbourne, I think it's so great. So the findings that we've had in terms of community-based organization to encourage linking services, testing services, are done through direct outreach, so face-to-face communications, and the use of anonymous clinics and testing sites such as mobile testing. And indirectly, our community-based organizations have used social media, advertising, and other campaigns. There's also some organizations that were able to use financial incentive to encourage MSM to use services, testing services. However, this is very far and few between because of the financial constraints. There are different ways that our communities do use different tactics to engage with MSM to do HIV testing. So directly do testing through training of volunteers, or that the blood test was done by medical personnel within their drop-in centers. Or if that is not available, then it would be done by referral to partner organizations that can conduct those services. What our partner organizations have expressed is that it's not just about the testing alone, it's about the quality of services. So how to ensure that you do follow-up to referral and confirmatory testing. And it is reported that despite all efforts, some clients are lost, mainly due to the waiting time for the test results and the disclosure of the results, so about our disclosure clauses, and the need for more accuracy HIV testing readings. Linking MSM to care. So organizations on the ground are referring positive MSM to other partner organizations that can provide ART or HIV counseling in terms of groups, case management, and other government medical assistance, including clinical psychologists and other support through networking support groups that can also be online or face-to-face. However, most organizations do report that there is constraints in terms of ensuring adherence. In general, client experience of HIV counseling and testing services and linkage to care and treatment was reported to be encouraging, and that the involvement of the CBOs and the volunteers actually help to retain. From our communities, there is a willingness to provide and actually demand comprehensive service provision. However, there are a list of barriers that CBOs and NGOs are not able to provide those services, including lack of funding, technical resources not always being available or available in a more sustainable way, lack of experience to manage such undertaking, so investment for NGOs to become more professionalized. And there is a need to increase the availability of services. NGOs also reported high dependence on their volunteers. So resources need to be made available to ensure that they do become health professionals and they do get salaries to do the work, to reaching out to their communities there. So the recommendations that we received were messages need to be targeted at the MSM population. So right now we do know that the younger MSM are more high at risk. The NGOs and CBOs should also move to more innovative and creative incentives to lead members to HIV testing. NGOs and CBOs need to be really recognized as part of the health system strengthening, and that proper funding is channeled to them to be professionalized for training, to retain staff, and to build capacity. There is also a need for more accurate and reliable on-site testing needed to be developed. So the policies that do discriminate or criminalize MSM activities needs to be removed, so then more of the MSM can be referred to the services. The gaps in the knowledge needs to be bridged, so that's through training and experiential learning. And again, funding to ensure sustainability of the community-based organizations and services that they provide. In terms of what APCOM has done in the region, we are currently launching a regional testing campaign targeting at young MSM. And what I would like to present to you now is a pilot that we are doing in Bangkok right now called Test BKK. Because we know that 1 in 3 MSM in Bangkok are HIV positive, but the testing rate is very low. And according to 2012 statistics, 41% of new HIV infections is through MSM. So the target audience that we want to ensure that is not traditionally being supported through community-based organizations, so young gay men, young MSM, who have access to social media, so Facebook, Instagram, YouTube, Grindr, Jack.D, Hornet, and these will be a bit higher educated young men. And our approach is through partnership. Community alone will not be able to do this. However, we need to link up with the government, testing sites, and private sectors for this to be rolled out successfully. So within this campaign, it's being supported by the UNAIDS, PSI, Silom Community Clinic, the Thai Red Cross, Rainbow Sky Association of Thailand, Swing, Hornet, One Touch Condoms, and Treasure. So it already shows that the community can actually lead the process and help to bring all the stakeholders together. What is really important, which is our finding from the report, is that the community needs to own the messaging, needs to be able to do the messaging themselves. So for young MSM, for these particular campaigns, they were involved in the development of the slogan, as you can see here, and the imaging as well. So it talks about more sex positive and be able to relate to the target groups. So not being afraid to say suck, fuck. However, you have to do a test and also to repeat the process as well. So in Thai, it would be om, ao, truat, sam, but I'm just showing you the English version here. So this really speaks to our communities. So through the social media campaign, one of the ways that we are launching the campaign is through YouTube, and the video clips that we've done to get the young MSM in Bangkok to be a bit more concerned or more knowledgeable about HIV testing. It's a 1.5 minute clip that you can go on our Test BKK website to look at, but it talks about how the young guys can be more empowered to go and do HIV testing without being awkward or afraid, because testing now is easy. We also target spaces, online spaces where young MSM go to, and not just like hotspots. So this is a quick example of Grindr messaging. Doing campaigns online only will not make it real for other people on the ground. So our campaign has to target spots, and using the collaboration with our community-based organizations in Bangkok to help roll this out on the streets in hotspot areas to make it a bit more real. So our campaign was only just launched in April, and we're hoping to get the first evaluation by the fourth quarter, and we hope that to be able to share that with you later. Early indications, though, from our video campaigns, 500,000 people have either liked or shared on our social media. So it's we've received a lot of praises to be bold, and the younger people, they really like it because I think it's the first time that it speaks to them, and Thailand hasn't had any kind of like campaign like this on social media before. So again, thank you very much for the opportunity, and our report is also available out in the front, so please do take a copy. Thank you.